Now, most children will hurt themselves at some time. They will fall over things, fall out of things, or fall down things. Usually the damage is only skin deep, but sometimes it's much worse. Something like a fractured elbow can be very painful and very difficult to treat.
And that's why there's interest around the country in surgery being pioneered in Luton. An orthopaedic surgeon there has developed a new technique to ensure that growing bones, like these, can heal more effectively following a fracture. Every year, 25,000 children between the ages of 5 and 8 require surgery for a fractured elbow. One reason NHS hospitals elsewhere will be taking it up.
Leah broke her elbow when she was 3, a simple fall from the climbing frame in her garden, leaving her with a serious fracture. 2 years on, however, and you'd be hard-pressed to tell which arm it was she hurt.
Her arm is absolutely perfect, and she gets complete movement over it, out of it, and the only way we can tell that she was injured was a little scar on the back of her elbow. Just a little scar down here. That's the only evidence that it ever happened.
And it's down to this man, El Rashid Saeed, a Sudanese-born orthopaedic surgeon who's not afraid to think outside the box. His pioneering procedure, aptly named the Saeed procedure, means that rather than open surgery, the elbow fracture is manipulated by hand, popping it back into place rather than a lengthy period of traction. In other words, it's lateral thinking. He pictures in his mind how the bone was broken, then reverses that action, thus putting the pieces back together again.
This one will save time for the theatre itself, will save time for the hospital. Recovery will be very quick and less complication. No scarring, and even scars there will be very little small scar, not like open scar. There is no stiffness elbow, no deformity. It's very good, and the way we do it now.
So everything's quicker, and time, of course, means money. Cutting the operation time from 3 hours down to 30 minutes, hospitals throughout the country could make an efficiency saving of over £10 million. This is thought to be a world first, but it won't be for long. Already other hospitals throughout the country are learning it, and successfully. Expect it to go international shortly. And judging by Leah, it also works for the patients. Does it still hurt?
No.
Joseph Hall, BBC Look East, Luton.